So Steve, one of the common things that people experience when they're out fishing is they get the hook embedded into themselves or an animal such as their dog or their child, and the hook obviously has to come out. In most cases, an embedded hook is not going to go all the way through, so it's going to be, you're going to have the barb, has the little barb on the end, so that when that goes into the skin, that barb is going to catch the skin and embed the hook, and it's not going to want to come back out. So the quick and simple treatment that I use in the field for this, I carry some topical lidocaine in my go bag. So where at the site of the hook, I would apply some of the topical Novocaine, or if you have a lidocaine patch, you can put that on. I recommend you wait maybe 5 minutes. I don't know the exact amount of time, but you want to give the lidocaine some time to get down into the wound, because it needs tissue to absorb the lidocaine adequately to anesthetize the area. So once you have it all what you feel to be is about as good as it's going to get, you can take a pin or a sharp object and just see if somebody can feel it. But it's going to come out pretty quickly, and it's a pretty small hook, so it might hurt just a little bit, but not a whole lot. And all you'll simply do is, when it's embedded in the skin, is just continue back through the skin until the barb comes out the other side, and then take a pair of pliers, whatever you have in your kit, and you want to take the barb off. So just below the barb, you can cut the barb off, and once the barb is off, you just back the hook out and you're done. And then you can clean the area, and again, you can put some more lidocaine on it before you bandage it, because it probably is going to sting a little bit later. But that's it. Very simple.
All right, that was a great tip of how to get a fish hook out of you. That happens more often than we care. But let's continue on our conversation with North Main man, also Dean, because he is that trained flight medic for the U.S. Army, and he spent a bunch of years in the EMT, as an EMT, and also in the ER. So let's say that it's something a little bigger than a fish hook. Let's say that we have a cut or some kind of wound, and it's bleeding. What do we do?
Sure. Well, the first thing you want to do, obviously, is stop the bleeding. That's priority number one. And you're going to be dealing with 3 types of bleeding. There's arterial bleeding, venous bleeding, and capillary bleeding. Capillary bleeding is probably the worst or the least serious of the 3. And if you think about a visit to the doctor's office where they poke your finger and take a little bit of blood, what's actually bleeding are the capillaries. The second type let's jump to arterial bleeding. Arterial bleeding is the most severe of the 3. And you'll know it when you see it, because the blood tends to spurt out of the body. The color of the blood tends to be bright red because it's coming from the heart and the lungs freshly oxygenated. If you have bright red blood that's spurting, you have an arterial bleeder. I can only tell you that that's a true medical emergency. If that person doesn't get help right away, they're in trouble. And we'll talk about how we stop that bleeding in just a minute. The next, and probably the most common type, would be venous bleeding, and that's generally what you would get from your head going through a windshield, or you had a laceration on your arm and that didn't nick an artery. That's all venous bleeding, and it too can be dangerous, but it's much easier to control than our arterial bleeding. So let's talk a little bit about controlling the bleeding, which is the goal here. We have a couple different methods that we use to control bleeding, and they can be used together or separately. But if you came to me and said, "Geez, Dean, I just sliced my arm," the first thing I would probably do is elevate the arm and get some direct pressure on it, like so. Keep it above the heart. That's what you're trying to do. Elevate it and then keep direct pressure. And after a little bit, I'd keep checking it just to see how we were making progress. And if the blood was clotting and the wound was settling down, I would probably just wrap it up and let it sit in place, and then address it later on. So elevation above the heart and pressure. There's also direct pressure, which is actually getting right on the bleeder with your digits, your fingers, and just pushing down and try to get that to stop bleeding and clot. With an arterial bleeder, you're going to have to probably go with more aggressive measures right out of the gate. Likely elevation is not going to help you. Direct pressure may help you. Another thing that you can do is put compression on it. That would be a bandage with an ACE wrap to kind of compress things, kind of like the snake bite, and get it to clot and stop bleeding. The other method would be application of something like a blood pressure cuff. If you're a really well-stocked prepper and you have a BP cuff, you can actually put a dressing over the wound. If it's this works well on an arterial bleeder too. You can put a dressing over the wound, put the cuff on, pump it up, and you've got an instant wound compress. And then if all these things fail, you can, your next, I would, actually the next one, the quick clot, I would go right to number one these days. That's my go-to product, or my go-to method if I'm dealing with a bleeder. And so if that failed, you'd probably want to, fall back to these other things. However, in the case of like a severed arm or a severed leg, you're looking definitely at arterial bleeding. You're going to want to go with the tourniquet probably, and quick clot. I would not hesitate to get quick clot on anything that's exposed to like an artery or vein, and then get a tourniquet on it. You can buy commercially available tourniquets, which they're pretty, they're turnkey products, or you can make one. You can make a tourniquet with something as simple as a stick and a piece of cloth. And you want to make sure that if you're doing your own, it's got to be wide enough so that you don't crush the tissue. So you want to have a little bit of width to it, and then you just go around the leg and put a knot in it, put anything that's rigid like a stick or a piece of metal or something through it, tie a knot, start turning, and you turn until the bleeding stops. Now, a lot of people in the past have said, well, you have to back it off every once in a while, and that's totally wrong. Once you've got the tourniquet on, the bleeding is stopped. Don't touch it. And once you get the tourniquet turned down to where you want it, you take another piece of cloth and just wrap it around the stick and tie it off to keep it in place. Then you could, let's say it's a leg injury, I would probably elevate the leg. If it's an arm injury, I would try to keep it above the heart. You want to watch for signs of shock, very common. But if somebody has lost a limb, it's you're at the outer limits of what you can do. So
let's say you have a wound that has an object that's impaled in it. What would we do with that?
Impaled objects, that could be anything from a screwdriver to a fence post to a tree limb. And we have a simple rule of thumb with impaled objects: unless it's in the cheek, we don't touch them, we leave them in. Reason being, we don't know what type of damage it might have done going in. It could be holding a blood vessel closed, and you pull it out, and then you have internal bleeding and so forth. So the typical wisdom is, let's say you fell on a stick. Well, fell on a tree sticking out of the ground. We would cut the tree off, and leave the tree in you, and just stabilize the entry points, okay, and wrap them off and transport. But it's like with the eyes. We don't mess with the eyes. If somebody has an eye injury, we just cover off both eyes to restrict movement, and do nothing else. You don't try to pull things out. The only part of the body you take something out of is the cheek, because you're not going to do any damage. But okay, or something up here. But as a general rule, it stays in.
So let's say you have that whether it's an arterial bleeding cut or a laceration or an impaled object. How do we treat that wound over the next couple of days?
Well, it's in many ways pretty straightforward. Keep it clean, dry, and covered. You want to check it constantly for drainage, signs of infection, which would be hot to the touch, red, stripes running up your arm, maybe a fever or temperature. All could be caused by that wound. But typically, after you get the bleeding stopped, you get the wound cleaned up, I would go with just your basic over-the-counter antibiotic, and then clean, dry dressing, and cover it, and you're done.